All right, well, let's get this show on the road. I know that, how many of you care about your children's education? That's why I'm here, and that's why the Secretary of Education for the United States of America, Arne Duncan, is here, okay? How many of you care about the health care of your children and your communities? All of you, right? That's why the Secretary of Health and Human Services and the Director of Indian Health Services, Yvette Robidoux, Kathleen Sebelius, that's why they're here. Give them a round of applause. And how many of you care about jobs for your communities and for young people and economic development? That's why the Secretary of Labor, Hilda Solis, is here. Okay. And you know that we can't do our work unless we have great leaders in the United States Congress, and today Congressman Kildee is here. Thank you for doing so much for Native Americans and for our country. Thank you so much. Now, we're going to follow the same format that we have been following, but we're going to do a little bit more interaction than we did in the last panel. And so what I've asked each of the panelists to do is to hold their remarks to about 2 to 3 minutes, and that way we'll have an opportunity to have more interaction. After the panelists speak, we'll have, I think, the 5 or 6 designees that I was given by you to make a short statement, and then we'll have an interactive dialogue with the members of the audience. So first, I am going to turn it to Secretary Hilda Solis, who is the Secretary of the Department of Labor. Hilda, give her a round of applause. She is one of the awesome members of the cabinet. Thank you.
Thank you. Thank you, Ken. It's a pleasure to be here with all of you, and I want to thank you for inviting me here. And I also want to say that this truly is a historic event, and I'm so proud to see so many of you here to join us in this wonderful celebration. I also want to briefly apologize. Yesterday at the Department of Labor, we also had our Native American ceremony and actually a conference to provide information to our tribal leaders about the services that the Department of Labor had. I was in another country. I was in Honduras, and we were tied up there with some issues. But I did want to say that we were very happy that response that we got, that people had a lot of questions, and I think I hope people walked away with information about tools, information about education programs, education and training programs, grants that we're giving out, $500 million that has gone out, that will be going out and announced in November for green jobs. This is for communities that we hope will engage and begin to train and do some serious work on renewable energy. And when people ask me what's a green job, I say it's a job that can be transferred from someone who was an electrician, someone who was in construction, someone who changed light bulbs, someone who works at a computer, and someone who wants to take that challenge to get into renewable energy. And these jobs will pay, I believe, anywhere from 10 to 20% higher wages. And the best part about it is that these jobs will stay here. So we talk about solar energy, biofuel. We talk about converting even our waste to methane gas that can help provide electricity, opening up the electric grids across our tribal country and making sure that people have jobs that will pay well. That's going to be our priority for the Department of Labor. I also want to say that we're very, very focused on the high unemployment rates. And I know in Indian country it's very high. And I know that we have much to do in terms of expanding the role of the various groups that have already partaken in some of our programs, but making sure that we have partnerships, that we really have good lasting jobs, that we really make it meaningful for our young people, but also for dislocated workers. So that's a big effort that we want to expand. There's new monies that are going out in that way. I also want to say that we're going to be holding a series of our own conferences so that we can get consultation and advice from our leaders, from our Native American and our different tribal leaders, so that we can put together programs to help us better reach your community and communities across the country. I come from a district originally in Los Angeles. We had one of the largest urban tribes, the San Gabriel Tongva Indian group. They're not formally recognized, but they are there. And we know that there are many challenges with respect to education and healthcare, and in particular jobs. But across the country, our effort is to make sure, number one, number two, number three, jobs, jobs, jobs. And making sure that we have all our Native Americans participating in every aspect. And I'm also talking about veterans. We have many Native Americans who have been neglected in terms of receiving appropriate health care and assistance in employment opportunities and job training. Homelessness is a big issue in our veteran community with Native Americans. We have funded new programs to help go out there and help to reintegrate and get people back on their feet, but to do it in a way that is culturally sensitive. And that is a big priority for me. Lastly, I just want to say that we are very vigorously undertaking, I think, a big effort to transform the diversity of our department. You know, our department has been around for many, many years, decades, but not everyone understands what the Department of Labor does. We do many, many things. We work on contracting. We want to make sure that there is no discrimination against Native Americans and tribes and different business groups that are out there that are seeking federal assistance to get those contracts. Our job is to make sure that that discrimination stops and that we make every available effort to see that we can get those grants out. So I am very much looking forward to hearing from you and excited to be here with Secretary Salazar and my colleagues, and look forward to working with you. If you have any questions or information, look us up on our internet, www.dol.gov. Give us a call. We're there. We're ready and waiting to work with you. Thank you very much.
Thank you, Secretary Solis. And the former governor of Kansas and the star of Health and Human Services, Secretary Kathleen Sebelius.
Good afternoon. Well, I'm delighted to join Secretary Salazar and my good friends on the cabinet, and particularly one of our great new superstar leaders in the agency, Dr. Yvette Roubideau, here today. Yes. As you all know, Dr. Roubideau is the first woman ever to head the Indian Health Services, and I'm a little biased toward women who run things, so she's going to do a great job. I think that the meeting today is a good indication of what the President has asked us all to do as cabinet members, and that's really work together in a collaborative fashion to deal with his priority issues. His being here this morning and back to close the conference this afternoon, but hosting the conference in the first place gives you a good indication that you have the attention of the President of the United States, and he has made that clear to all of us that this is a priority to fulfill commitments that for a long time have gone unheard and unmet, and we're here today to meet with you about those goals. We look forward to responding to his call to put plans together in the next 90 days, and I'll be working closely with Dr. Roubideau to make that happen. I was pleased to have a chance to meet with many of you when you came to HHS on Tuesday, and not only had an opportunity to meet with me, but all of our key new leaders and agency heads, because we really believe in our department the delivery of healthcare and human services to everyone is our priority mission and something that we're eager to do. As Ken Salazar just said, I am the former governor of Kansas, and I am a strong believer in government-to-government relations with tribes. I did that during my term as governor and intend to continue with consultations as secretary, and I think that's a critical part of our moving forward together to get your input, your ideas, and everything from legislation to budgets, and certainly how we're delivering our services. In fact, my first day as secretary was spent with some of you when you were in the Department of Health and Human Services on a budget consultation, and I had the opportunity to at least introduce myself. I wasn't quite sure where I was at that point, but you were there, and it was a pleasure to do that. We want to strengthen our consultation process and our partnership with tribes, not just in the Indian Health Services, but really throughout all of our agencies, which is why we wanted the agency leaders to all be there. So whether it's mental health services or children and family services or critical work on food safety issues or our preventive efforts through the Centers for Disease Control, it is not just that the Indian Health Services will have a look at that. We took a big step forward last week when the President signed the Interior Appropriations Bill into law, giving more than $4 billion to the Indian Health Services for the 2010 fiscal year. Now, that's a 13% increase over the last year, and the largest increase in Indian Health Services in the last 20 years. But we see that as an important first step. That is not the end of the story. That is the beginning of a commitment to make sure that there are excellent health services across this country. And we're going to continue to look for ways to continue that. I want to tell you that IHS is a priority in my 2011 fiscal year budget, too, which we're currently in the process of discussing. Finally, I just want to mention briefly that I know we are all dealing with the flu outbreak, and we had an opportunity on several occasions with Secretary Salazar and Secretary Napolitano with Homeland Security to host 3 national tribal H1N1 tribal calls to try and get the word out over the last couple of months. And we've sent out resource guides for tribal communities. The IHS is working closely with the Centers for Disease Control to monitor the flu and get information out. And I want to tell you, Dr. Rubidoux has reported that there are some concerns about distribution at the state level and whether or not the tribes are getting an equitable share, and we will take that very seriously. It's the first time I've heard of that, and I promise you we will be all over that. That is at the local level, but we are in touch on a regular basis, and that will be a top priority for me to follow up on. We are getting more vaccine each and every day. As of today, we have 36 million doses out and around the country. We expect another 10 million doses over the next week, and each and every day governors are drawing down those orders and pushing them out. But we want to make sure that they're coming into tribal country, and I will take that as a personal responsibility. Your help as leaders, encouraging particularly your priority populations, pregnant women, children aged 6 months to age 24, people with underlying health conditions to get a vaccine is very important. It is safe, we know it works, and what we need to do is make sure that the priority groups get to the front of the line. We will continue to distribute vaccine until everyone who wants to be vaccinated has an opportunity, but we need to start with those who are most likely to be seriously ill or face death with this disease. So we will continue to work with you, and I look forward to having a discussion as we move forward.
And Dr. Yvette Rubidoux.
Thank you, and good afternoon, everybody. I had an opportunity to introduce myself this morning, so I will be very brief. And yes, I was corrected by several tribal leaders to make sure that I reintroduced myself as Dr. Yvette Rubidoux, a member of the Rosebud Sioux Tribe, the ninth director of the Indian Health Service, and the first woman. I'm really grateful and honored to be a part of the Department of Health and Human Services and to have a wonderful leader like Secretary Sebelius. She has shown great leadership and great commitment to all Americans and their health, including First Americans. And so I can tell you that in our leadership meetings, they're always willing to talk about tribal issues, and I've been working closely with the other agency heads to make sure that your issues are their issues as well. And I'm beginning to be a little bit of a broken record, so but I'll continue doing that on your behalf. I'm really grateful to meet with you all on this historic occasion. Thank you to all of you who came to the round table on Tuesday. And I also want to thank you all for your honesty and for your emotion and your commitment and your passion when I've sat with you at the table and you've told me of the significant health issues that are facing your communities, the problems you're having with access to care, the problems that you're having dealing with chronic diseases, the problems with old facilities. I've heard all of those issues, and we are committed to trying to do what we can in this incredible time of hope and opportunity to make progress towards further meeting our mission of the Indian Health Service and making sure that First Americans have access to quality health care. So again, I'm looking forward to partnering with you. That's my top priority, and look forward to working with you over the next few years. Thank you very much.
Thank you, Yvette. Congressman Dale Kildee.
Thank you very much, Mr. Secretary. Thank you very much. I want to commend President Obama for convening this very important conference between the United States of America and the sovereign tribes of this country. I always point out that the sovereignty is recognized, not granted, recognized in this Constitution. Article 1, Section 8, Congress will have the power to regulate commerce with foreign nations, the various states, and Indian tribes. Your sovereignty... Your sovereignty is not a granted sovereignty, it's a retained sovereignty by all the court decisions, starting with John Marshall. I carry that with me, too. Most of you know. But even during the campaign, the president indicated his concern, interest, and knowledge of your rights as Indians and your sovereignty. He did that much like Bob Kennedy did. In 1968, Bob Kennedy visited Pine Ridge, some of you may remember that, and other Indian areas in the Southwest, shortly before his assassination. So we have a history of trying to undo some of the sins of the past, and this president is continuing that tradition. One thing, unfortunately, with the new president, he looked at great people and put them in the White House, including Kim Teehee, who has worked for me for about 12 years. We all know Kimberly, and she is now the first ever senior policy advisor for Native American affairs. I miss her, but I'm very proud of her. You know, my own personal history goes back to the time I was about 7 years old when I was making my first Holy Communion. My dad had come from Buckley, Michigan, near Traverse City, Michigan, near the Grand Traverse Band of Ottawa and Chippewa. And he always told us kids that the Indians were treated unjustly. And that really became embedded in us. So when I got to the state legislature, I remembered that. And I figured I had some opportunity. And everyone should seize the opportunity to make sure that we bring justice about. We should all be seekers after justice. I introduced a bill called the Indian Tuition Waiver Act. I read the Treaty of Detroit, and we should read our treaties. They're very important. The Treaty of Detroit promised education in return for the millions of acres of land that were taken from the Indians, and they weren't being given that education. I introduced the bill, which is still law in Michigan, that any Michigan Indian can go to a public college and the state pays the tuition. And that's still the law. When I came to Washington in 1977, I decided to do that here, too, if I could. And I was in Education and Labor Committee, and I visited Indian schools. And I saw schools that I know a federal judge would not let us keep prisoners in, because we had the main prison in my district was ordered torn down by a federal judge because it was unfit for human habitation. And that prison was in better shape than some of the schools I was visiting, BIA schools. And that is wrong. That's morally wrong. We have to follow the law, but we also have to follow morality. And I commend every one of the people at this table who have committed themselves to do that, to follow the law and follow your moral compass. You are all citizens of the United States. You are all citizens of your respective states. But you have a unique citizenship, which which I do not have. I have two citizenships, citizen of the United States and Michigan. You're a citizen of the United States and your respective states, and you are a citizen of your sovereign tribe. You may note that in my talks, I never refer, and you may call yourself anything you want because you are sovereign, but I never refer to members. I always say citizen of tribes. I'm in the Knights of Columbus. I'm a member of the Knights of Columbus, but I'm not a citizen of the Knights of Columbus. You are citizens of your sovereign tribes, and fight to retain that citizenship and fight to retain your sovereignty. They'll never come by with one axe and take a big whack away, but they'll take maybe a scalpel, try to slice away some of your sovereignty. Don't let them take one slice. God bless you.
And the champion for children and education throughout, the Secretary of Education, Arnie Duncan.
Thank you so much. And this has been a fascinating 9 months so far. And I think I've been to 33, 34 states so far and literally hundreds of schools. But I will tell you that the school visit that stands out most clearly in my mind was my visit to a school in Montana, northern Cheyenne country. And it was both unbelievably inspiring and it was also devastating. And it's one that is deeply, deeply impacted me. And my staff has been, Greg Darnita's been to North and South Dakota to visit schools. Charlie Rose has been to New Mexico to visit schools. And it's amazing how personally impacted those visits have been for us. I will tell you, I saw students who were smart and capable and wanted to do well. And that was the hopeful part. The devastating part was the lack of opportunity. The subtle and the overt racism they faced, the low expectations they faced, and you could see students as they got a little older starting to give up, and you could see hope starting to fade a little bit in their eyes. And so, ladies and gentlemen, we have to do dramatically better. We have to get dramatically better. If we want to give our children a chance to be successful, the status quo is not going to get us where we need to go. So what do we do? A couple thoughts, and these are profound and deep conversations that we're not going to solve here in an hour. But there are a couple things I want to talk about. One is, as we talk about dramatically improving the quality of education for our young people, we must have a deep respect for native language and native culture. And I think far too often we've tried to strip that away from our children. And if they're not rooted in their heritage, if they're not rooted in their community, our children are lost. And we have to create an environment in which that stays. Secondly, in all the conversations we've had, we've heard repeatedly the tremendous teacher turnover. And teachers come for a year or two, or sometimes 2 months or 3 months and disappear. So we have to think collectively very, very hard about how we grow our own teachers. How do we grow teachers from the community? How do we grow teachers who are rooted there, who want to come back, where this is not a stepping stone, but this is a life's passion. And we have to think very, very hard about how we create that next generation of teachers to serve our young people. And the only way we do that is if we start to talk to our 3rd and 4th and 5th and 6th graders and our freshmen and sophomores in high school about becoming teachers now and create those pipelines. And we're starting to formulate, I think, some pretty interesting ideas about how to do that. There are tremendous capital and infrastructure needs that the Congressman talked about. And we're lucky to have over $400 million that we're going to work with the BIA to work on renovation and rehab and new construction. That we cannot have schools that are second to jails. And as the Congressman talked about, unfortunately, that's often the reality. And so we want to put significant resources there. We have unprecedented resources to increase access to higher education. Billions of dollars in new money for Pell Grants and Perkins loans. And so we have to make sure that every child that works hard and wants to take that next step into higher education has the resources behind them. And the President and a bipartisan Congress have provided extraordinary leadership there. So we want to make a major investment. Already, this happened through the Recovery Act, over $30 billion there, and through a bill that's passed the House of Representatives before the Senate now, would bring about another $60 billion in increased access, the higher education bill. And so if that goes through, it will dramatically increase those kinds of opportunities. The final thing I'll say is that we have to collaborate and work and behave in some very, very different ways. Everyone here knows the Department of Education historically and the BIA have not worked well together. And this is not a unique challenge. Folks know that historically in early childhood education, the Department of Education and HHS have not worked well together. And I'll say this not just because they're here, but I am absolutely hopeful about the direction we're going. In Kathleen Sebelius and Secretary Salazar, we have extraordinary leaders who have no ego, and all of us just want to do a better job. It's not about whose budget or whose department or who gets the credit. How do we dramatically improve early childhood education? How do we dramatically improve education for all? And I'm absolutely confident that we have collectively the leadership with the will and the lack of ego to do the right thing by children. The final thing I'll say is that one of the inspiring parts about my visit to Montana was that's the only state in the country that has an Indian Education for All curriculum. And I think that's a model that we need to look at very, very closely as we move forward. But these are conversations that have to continue. They have to continue with a real sense of urgency. I look forward to working with you to give our children a much better chance of fulfilling their tremendous academic and social potential. We have to do better. Thank you.
Thank you very much. There is a role, a very significant one, that Interior does play with all of our colleagues, and certainly the role that BIA and through the leadership of Larry Echohawk are playing with the 183 elementary and secondary schools and dormitories is very, very important for us. 47,000 students in 63 or near 63 reservations in 23 states. And through the President's Recovery Program, we have made and will be making significant investments in that educational system. But I think Arnie perhaps hit it on the head best, where it's not about Interior, it's not about BIA, it's not about education, it's not about Arnie or about Ken or Kathleen or anybody up here. It really is, at the end of the day, somebody in one of the earlier conversations asked, well, where are the milestones and where are the timelines? Well, we'll be able to know whether we make a difference, and it's a collective effort. And we will see whether or not our children are doing better in a few years based on the kinds of investments and leadership that we have going on here. At this point, what I would like to do is to then call on the people who were identified for us, and they are John Felice from the Pacific, and following him, John Windy Boy from the Rocky Mountain region, and then Chairman Ned Norris, and then Chairman Derek Bailey, Governor Mark Mitchell, and Chairman Rodney Bordeaux. So, John, are you here?
I'm here.
So,
Can you hear me?
and what we'll do is we'll go through each of you. There's 6 of you. And then what I'll do is we'll just have the members of the panel respond collectively to whatever issues you might have raised, and then we'll go ahead and have an interactive dialogue after that. So go ahead, John.
Thank you, Secretary Salazar. Good afternoon, members of the panel, respective secretaries of the agency, Director Rubidoux. I'm honored here to be here before the panel and to be joining in unity with the tribal leaders today. My name is John Felice Jr. I'm the chairman of the Coyote Valley Band of Pomo Indians. It's compelling to be here, but also emotional to hear the dialogue that has been exchanged today. I'm only 31 years old and joined our tribe at the young age of 26 and have experienced, through the various experience on the tribal council, the weaknesses within the level of funding, the level of care, and the lack of education that we provide to our people. A lot of the things that I wanted to say have been echoed by the panel and throughout this afternoon. Secretary Duncan, you've pretty much taken some of the comments I wanted to make verbatim. What I would like to do is echo the priorities that were submitted to the President by the National Congress of American Indians and highlight those priorities for all of Indian country. In addition, I would like to spotlight and raise your attention to the healthcare disparities that is experienced all throughout Indian country. The level of care for our people should never be dependent on the level of funding. That's not the way that we can improve the quality of life of our tribal people. In addition, we asked, recently the Indian Healthcare Improvement Act was included in the healthcare reform bill passed by the Senate Finance Committee. We would ask members of your panel, your respective agencies, and President Obama to support keeping the Indian Healthcare Improvement Act in the Healthcare Reform Act as it stands right now. In addition, we ask that you would promote, in conjunction with the tribes, more awareness through education, through prevention methods, and through the promotion of wellness for our people. Through awareness, I believe that will lead us into educating our people on obesity, the rates that we suffer as far as cancer, diabetes, and the ways that we can take care of our health. With regard to further education initiatives, I also echo the Secretary Duncan on the language and the services required to promote language in our school systems. Promoting culturally based educational activities cannot be anything more imminent than connecting our students to their culture in the school system, and also addressing the common core standards regarding education in Native American country. Thank you.
Thank you very much, John. Jonathan Windyboy. We got you covered.
Thank you very much, Mr. Secretary. Kakio nawaku magan tignanaskung tenumo te pedote gumota. Ego kakio nawaku magna kumata tapuenanaskumun. Ladies and gentlemen, I want to introduce myself. My name is Jonathan Windyboy. I'm the Vice Chairman of the Chippewa Cree Tribe, and I'm also a State Senator for the state of Montana. And I want to give a little different angle on this. And first of all, before I do that, I want to, first of all, ask about the Indian Healthcare Improvement Act, and that, you know, we're always being reauthorized every 10 years. And I ask you to please make that permanent, so we don't have to come and beg for every 10 years to try to give us our basic right of health. Second of all, we have the Indian Self-Determination Act and Title VI giving the tribes the opportunity to tap into a lot of the other services and departments under HHS, and I think that if we go in that area, it would alleviate a lot of the shortfalls that we have. I'm also a member, one of 30 legislators, Secretary Sebelius, with the state legislators with the White House healthcare reform. And every time when I ask about how Indian healthcare fits into this care reform, I'm always assured that it's going to be addressed. But I want to ask you if you can go more into detail of how Indian healthcare is going to be addressed and how it's going to play an impact on Indian country, and address it to all of my colleague tribal leaders here, and so that we will know. And also too, you know, on the local levels, we have a lot of programs. We don't, there is no cancer screening in IHS. We have a lot of mental health needs. We have a lot of behavioral health that deals with drugs and alcohol, PTSD. We have a lot of issues dealing with just everything in general in behavioral health, and we ask that we be a part of that, a part of the planning process. And also in the education arena, you know, we ask that we look at technical assistance centers for Indian education for all. Language preservation and cultural heritage preservation is something huge, and why I say that is because 60% of my 6,000 members are 25 years and younger. And we have a population that is growing. We have a population of elders throughout Indian country that are leaving us, and it's very important for us to make sure that our heritage remains strong. A lot of times, you know, when we move forward, when we're talking about labor and how this all ties in together, you know, I'll give you an example. This past summer, I had a summer youth program. I hired 275 of my youth. And when we wanted to treat them just like any other employment opportunities, so we took them through a drug test. And out of those 275, 70% tested positive for drugs. And that's kind of ironic, because that's the reality of what us as tribal leaders have to face with every day. And not only that, we have TANF clients. We try to provide employment opportunities for them, and then at the same token, 50% of my TANF clients also test positive for drugs, and meth is on the incline on that. And how does this all relate to all of the issues that it bring forward? Well, we all have a high unemployment rate. 70% unemployment is what I faced with during the winter months, and that's kind of synonymous throughout Indian country. And I think it's very important for us that education, health, and labor all is in one, because historically, the man always goes out and hunts and works, and it's kind of it takes a toll on an individual's pride, on a man's pride, not being able to do that because the opportunity is either limited or not there. And so, when I bring forward to you about how all of this plays in, as a state senator, I see a lot of integral parts of this. As tribal leaders, we go to the feds. They say, "Hey, wait a minute! You go back to your states. We have some money that we given the states that you're qualified for." Well, by golly, we go to the states, and then the states said, "No, you go back to the feds because you're rewards of the federal government." So we're kind of like a ping pong going back and forth, kind of left out there in no man's land. And that's one of the things that the federal departments always tell us. That this relationship that tribes have with the states is hunky dory, but it isn't like that. And so when there are monies that you give to the states, what you need to do is bring the tribes to the table, because there are rulemaking processes and all of these other processes that impact tribes. And we need to be at the table so we can define what is appropriate and what is not appropriate, what is inappropriate for tribes. And it's very important that we be a part of this process from day one to the end. And so with that, I want to thank you very much for this time, and
Thank you.
give greetings to my brother if I don't get a chance, to Barack Obama. Thank you.
Thank you, Jonathan. Thank you very much. And Chairman Ned Norris. Ned Norris.
Thank you. Secretary Salazar, my name is Ned Norris Jr. I am the tribal chairman for the Tohono Nation in the great state of Arizona. We're in the southwestern part of the state of Arizona. Secretary Sebelius, all of the panel members, Congressman Kildee, Dr. Rubido, we really appreciate this opportunity to be able to be here and share these thoughts with all of you. Secretary Sebelius, thank you for that roundtable discussion that we had a couple of days ago. That was very fruitful. I only hope that the issues that we brought up will definitely get to you at your level, so that way we can begin to work together and address those issues. When we come here and we talk about government to government relationships, our hope, and I'm really encouraged by everything that I'm hearing thus far, that we are making the commitment, or we are submitting ourselves to support the ongoing trust responsibilities, specifically as it relates to health care and other trust responsibilities, but because we have a health panel related to health care. I wanted to share with us, all of us, as we continue our efforts to move forward on the Indian Healthcare Improvement Act, that we not lose sight of the fact that Indian Health is not an insurance program. Indian Health Services is not an insurance program. It is a federally funded trust responsibility of the United States to the Indian tribes. And as we look at the funding, we have to look at the disparities that exist within funding. You compare the funding for Indian Health Service, and we are extremely appreciative of the fact that we have a 13% increase in Indian Health Service funding for the 2010 fiscal year. Extremely appreciative of that. But we also have to continue to keep in mind, and I realize this is only the beginning, that we keep in mind that there are still some serious disparities between funding the Indian Health Service and other Indian programs throughout the federal funding process. When we look at providing services to our children and to our elders, Obviously, we want the best health care, the best health services available to our children and to our elders and to all of our citizens within our tribal communities. We have to begin to realize that we are losing our children in many ways. Many of our children are underdeveloped for whatever reason or another, and that this issue needs to be worked on between the Indian Health Service and the health providers within our tribal communities. We need to have a place at the table so that we can begin to work collaboratively in partnerships with the Indian Health Service, with the Department of Health and Human Services, with our own local tribal health programs in order to address those problems or health problems that we have to deal with in our tribal communities. When we think about pediatric health for our children, I think that's probably one of the most serious deficiencies in providing health care is the availability to have pediatric health care for our children. When we think of the fact that our children are learning a huge percentage of what they're going to learn as adults in the years from 0 to 5 years of age, we need to focus attention on the preschool, the newborns, and that age group in order to provide better health care for them and address their issues. I think it's important for us to continue to realize that within many of our tribal communities, drugs, alcohol abuse, diabetes, obesity, mental health issues are still prevalent within our tribal communities. We need to be able to continue to address those services as well. We need to effectively engage with each other in order to address these issues. I was, in closing, Mr. Secretary, I was just learned the other day, one of the tribal leaders, I believe, from Nevada, that there was, I learned a word, it's called endocrine disruptors, EDCs. And
I can't pronounce it either.
Yeah, I can't say it. This tribal leader shared with us that in a report, in the USGS report in the year 2000, that report identified that there are EDCs in streams where cities are located and that have a wastewater treatment facility. These EDCs in this water is the same streams that many of our people use to gather the food that we use to nourish ourselves and our people. If we're fisher tribes or whatever the case may be, and we need to begin to address that. We also need to, in final comment, sir, we also need to look at the disparities with regards to the providing of health services in each of the areas. We have an effort by one of the tribes to try and address those disparities and address the fact that the services are not getting to the people that need the services in those communities. And we need to be able to go back and look at and take an effective assessment of what the Indian Health Service is doing in all areas to make sure that we're as equitable as possible to be able to ensure that the services that we need from the Indian Health Services are being equitably distributed to all areas in all tribal communities within our nations.
Thank you, Mr.
very
Chairman.
much, sir.
Thank you very much. Secretary Sebelius and Dr. Robideau, you have a lot of answering to do, but I'm not going to call on you first. We still have 3 more people that I'm going to call on, and then we will have the panel respond, and then hopefully still have some time to get some interaction. So I would ask you to try to keep your comments, try to summarize them for us. So the next person is Chairman Derek Bailey. Derek.
Good afternoon, Secretary Salazar and esteemed panel. And I want to provide a warm hello, Representative Kildee, from Northern Michigan, the communities that appreciate all your hard work and service over the years. My name is Derek Bailey, and I'm the tribal chairman of the Grand Traverse Band of Ottawa and Chippewa Indians. We are a tribe of 4,000 members, and we are located in northwest Lower Michigan. I have been selected by the Midwest Regional Tribes to present the talking points on 3 subjects that impact the 35 tribes of Wisconsin, Michigan, Minnesota, and Iowa. The Midwest region is funded at the lowest level of need in all the IHS regions, with a funding rate of 33% of identified need. This lower funding rate leads directly to our region's lower life expectancy, which is shorter by an average of 7 years, and our higher rates of diabetes, cardiovascular disease, adolescent obesity, and upper respiratory diseases that are 2 to 3 times higher when compared to other IHS regions. President Obama's significant increase to the 2010 budget is appreciated. However, to meet the full needs of contract support, those increases will have to continue through the years 2011, 12, 13, 14, and beyond. Indian country health priorities are best identified by the tribes of the region. In the same manner, those health priorities are best met by Indian health professionals from Indian country. The Midwest region is requesting renewed support for Indian health professionals to serve the needs of Indian country. We applaud the appointment of Dr. Yvette Rubidoux from the Rosebud Sioux Reservation as the Director to Indian Health Services. The Midwest region supports the permanent authorization of the Indian Healthcare Improvement Act. We desperately need the reenactment of the Indian Healthcare Improvement Act to assist in establishing and monitoring or maintaining current healthcare programs in Indian country, like the tribally initiated Access to Recovery for the treatment of substance abuse in Michigan Indian communities, which is funded through the Department of Health and Human Services. We are the solutions to our problems. What we need is the statutory authority to empower our communities to implement our solutions. Indian education is a priority of the Midwest region. Secretary, when you started, you asked children questions, healthcare, education. As a father of 5, I resounded strongly. They're paramount as a father, as a leader. Education is important. American Indians have the lowest educational attainment of any racial ethnic group in the United States. The lack of coordinated funding between impact aid programs in the Department of Education and Johnson O'Malley and the BIA, coupled with the financial demands of BIA educational facilities, only serves to continue this awful trend for the Midwest region, since over 90% of our students attend public schools. At the minimum, this trust obligation should ensure the adequate educational attainment for all primary and secondary students. Now, in the same manner that the health needs and services are best identified and serviced by Indians from Indian country, the Midwest region is requesting demonstration projects to increase the number of Indian educators to be instituted by this administration.
Mark, if I may, I'm going to ask you to wrap up and summarize, because I'd like to get some response to the panel. I want to get some other people in as well. So if you can summarize for us and get to the quick points.
Chairman Norris took my 2 minutes.
So please don't keep going, but I want you to wrap it up, okay? Just get us to the points.
I'll get to the points, sir. And I apologize for the pause. I'll just cover the last area. We had 3 areas. And I'll end with that the last issue that relates to the above 2 priorities is the issue of whether general federal labor law applies to Indian reservations and enterprises operated by tribal governments. In all cases, treat tribes the same as any other governmental unit. This should apply to the Employee Free Choice Act, Internal Revenue Service rules, and labor laws. And Secretary, I want to end on a personal note. I've heard a lot of sharing, so I'd like that respect here this afternoon. My family, wife and I had a seasonal feast, and the elder said in his conclusion, after we offered those pipes and those prayers, and it rang true to me. He said, "What type of ancestor will you be?" And I look in this room, and I respectfully share that to hopefully inspire or to share in the symbolism that is for me by saying, what type of ancestors will we be? And I think today's opportunity and meeting speaks volumes for our future generations. Miigwech. Thank you.
Thank you very much, Derek. Thank you very much, Chairman. And now Governor Mark Mitchell. Governor.
Can you hear me now?
We can hear you. Yes, sir.
Good afternoon. Umbiagende kuan chatne. Nawe na kanne te o chu chan heri hori wemuri pogi ton sant ari mupe hori age mu kanne here o chu chan heri howe wenge to maramba gi to nawe handi bandi hori toy handi band to nawe ho I hi ande nin kama keri howe wo ishai hori bo nawe kuan chatne dione umbiagende awe hori meri hawi ansha horamai hore tu sopai hi. With all due respect, my name is Mark Mitchell. I'm the governor of the Pueblo of Tesuque, in the state of New Mexico. I'm also the chairman of the 8 Northern Pueblos Council. With me today, I have the governors of the 19 pueblos in the Southwest region regarding education. I think the education system needs an overhaul. Regarding year-round schools, I think on one hand, we need to look at the teacher side of things as well. As far as children going to school year-round, may have its pros and cons, so we might have to look at that in general. As far as the last administration, No Child Left Behind and Goals 2000, I don't think those are working. We need to relook at those items. But if we can come together at this, at a forum like this, and convey to one another and how we can work it out, I think that's how it'll work. But we have to work together. And as far as the Johnson O'Malley, it does need to get reinstated to its equitable amounts, because our children do attend public schools. As far as the BIE, that too needs to be relooked at. It's crucial because we can sit here and talk at the table and look at one another, but it's at the lower level. Those people that are out in the field that are working, they need to hear it from this level. So I hope that we can work together and move forward with it. As far as health needs, I think you heard it before as to the previous people. Those are the same things that we're looking at. Alcoholism, diabetes, personal care. We also, I guess in that arena, is also education. Because if we don't have that component in it, then nobody would know how to implement certain things that are coming down the pipeline. As far as, I guess, overall funding to tribes, we need to cut out the middleman and fund tribes directly so they know how to handle those funds. And along those lines, we talk about accountability, but I think it's a two-way street. We're sitting here, we're taking notes, and we like to hold you accountable and time frames put on those goals that we're talking about here today. And as far as you talked about, and I'm going to go back a little bit, NAGPRA. In the state of New Mexico, we have in this country, our ancestors left their footprints. And those that are here, that are celebrating their 400 years of existence, as I then told the state of New Mexico, those non-Indians in this room could probably retrace their ancestry back to Europe, wherever they came from. But we as Native people, our ancestors, are sitting in some museum on shelves collecting dust. I don't think they need to be there. So we need to really look at that issue as well. And I hope that our request here today does not fall on deaf ears, as it has for so long. As you all recall, President Obama said, it's time for a change. Let's take that first step and move forward with it. And as far as the pueblos of New Mexico, we like to extend the invitation to President Obama to come out and see us in Pueblo country. Thank you very much.
Thank you, Governor. Thank you, Governor. Chairman Rodney Bordeaux. Rodney?
I greet each and every one of you with a hearty handshake. My name is Rodney Bordeaux. I'm president of the Rosebud Sioux Tribe, and we are very proud of Dr. Rubidoux. First of all, I want to let you know that I'm representing not only the Rosebud Sioux Tribe, but the Great Plains region of the United States. home to the Great Sioux Nation, the Turtle Mountain Band, the Chippewa Indians, the Winnebago tribe, and also the Omaha tribe. We have the largest geographical area in the United States in terms of trust acres. We have 11 million plus trust acres, and we're home to 189,000 tribal members, second only to the Navajo Nation. In regard to education, we need to make the Johnson O'Malley program a permanent program. Instead of being cut every year, cut out, we need to at least fund it at $150 per student. This is one of the oldest educational programs for Indian students, pre-K to 12. And is a key supplemental program for Indian participation, Indian parental participation. Also, we would recommend full and complete funding, as well as forward funding for tribally controlled community colleges and universities, full funding for the Impact Aid program, where upwards of 80% of our Indian students are in public schools. We also request full funding for Indian students attending Indian contract and grant schools. In addition, we need to provide adequate funding for the operation and maintenance of these schools, as well as funding for the facility improvement and repair. Oftentimes, when it gets real cold in the Great Plains, our schools have to borrow from the basic educational needs for our students just to keep them warm. In addition, we would recommend that the Bureau of Indian Education, the BIA, hire a director who is from the outside the agency. We need the input of tribal leaders across this nation to fill that position. So we're asking for an outside member. Also, for our preschool students, we need full and adequate funding for the Indian Head Start program. That's a key basic program, and that's where a lot of our language restoration is going to begin with our tribal members here on the reservation and in the Great Plains. And we need to request at least $30 million in funding for the Native American Language Restoration Program. Right now, the Rosebud Sioux Tribe is going it alone, and we have to compete with other social needs, heating needs. So we, until we're economically viable as Indian nations, we come to you for further support of our language restoration programs. The Indian Healthcare Improvement Act, even though we're moving it forward on the House side, it needs to change to recognize the government-to-government relationship, tribe-to-tribe relationship. So we'll be making some needed changes in them as it gets to the conference committee on both the House and Senate. The Indian Health Service is only funded at 50% of our need in the Great Plains region. And due to the inadequate funding of the contract health services, when you refer it out, because our facilities do not have the funding to meet our needs, like in our area, Sioux Falls, South Dakota, Rapid City, since the Indian Health Service is not paying for those bills, our tribal credit is ruined. We even have individual students, like for example, my young son is only 12 years old. And if he's referred out to Sioux Falls and the Indian Health Service is not going to cover his debt, his credit is ruined, as well as all other tribal members. So this is a very serious issue. The funding needs to follow the IHS in that regard, instead of individual Indian members. And also on the Great Plains and the Rocky Mountain region, we have the highest suicide rate in the world. On the Rosebud Sioux Reservation, since 2006 to the present, we've had over 35 teen suicides and did not get any national press at all. So we're asking to convene a national suicide summit in the Great Plains, and we'd like to facilitate and work with the agencies on that. And this has to be hopefully an annual event, because we have the answers, but we need the cooperation and assistance of the federal government on this, because it is inexcusable. But we want to work with you on that. And in regard to youth care, youth employment, and adult employment, we want to challenge you to increase that funding. Oftentimes our youth do not have adequate jobs after school. It'll help with the self-esteem, help with their families, because our families help each other. So I want to thank you, Pilar Apolo, and I thank you very much for this opportunity. And I want to add that this administration, this cabinet, is the most visible and within 1 year than I've seen all the other administrations in all the 4 years, 8 years. Thank you very much.
Thank you, Rodney. Thank you, Rodney. Here is what we are going to do. I'm going to have Secretary Sebelius and Dr. Rubidoux maybe respond about 5 minutes. There are a lot of healthcare issues and the healthcare bill that were talked about, so maybe they can respond to that. And then I'll have Arnie speak to the educational issues, and Secretary Solis speak to some of the labor issues. We'll have Congressman Kildee say a few comments, and then we may have a little more time to squeeze in a few questions and answers. So why don't we start with you, Kathleen?
Well, thank you, Secretary. I'm going to try to just touch on a couple of topics. There clearly are a lot of initiatives that need to happen with regard to health in Indian country. And what I can tell you is that we're aware of the big gaps in services, the huge gap in funding, the disparities, which are shocking. And what HHS has done in the past is do a pretty good job of printing reports. What they haven't done very well is closing any of the gaps. And it's something that I take very seriously, and I know Dr. Rubidoux does. Let me just mention quickly health reform. The question was, how does this impact tribal citizens? And I would say that we recognize that the Indian Health Services is not an insurance program. It's a trust responsibility, and that's why in the bills, particularly the House bill, there is a clear exemption for tribal members to comply with the individual mandate. We feel that that's been on the table for centuries, and we need to fill our commitment. There are lots of pieces of the health reform bill that have nothing to do with the insurance piece, and they will, I think, have a very positive impact on tribal members. There's a big prevention and wellness focus that clearly could have an enormous impact on obesity and some of the chronic disease. There is a direction to raise the standards with chronic disease management and additional resources to do that. Again, unfortunately, in Indian country, we see those diseases appearing in younger and younger populations. There are resources in both the House and Senate bill to address health disparities and a directive to our agency to focus on that. There's a workforce diversity issue, both more scholarships to be paid off for students who are willing to work in underserved areas, and the tribal community is at the top of that list, but also a great effort to diversify the workforce and get members of various minority communities to become healthcare professionals, so additional resources, and our agency is working on that, so more providers along the way. The President has made it clear that one of his key areas of focus is maternal and child health, and again, we don't see this as isolated to the Indian Health Service. We want to make all of our agencies make sure that the tribal lens is in their radar screen. I know that one of the House bill includes the Indian Healthcare Improvement Act as part of health reform. We are supportive of that effort. We look forward to your recommendations as the bill proceeds in terms of what changes need to be made, and want to work with you to make sure that is reauthorized. Permanent would be a great idea. It is not something that's currently in the statute, but I think that change would be welcomed. And finally, I just want to also remind members that in the Stimulus Act, there was a historic investment in prevention and wellness that will be community grant opportunities. I met with the Indian Health Services board a couple of months ago to alert members about this opportunity. Those grants have not been awarded. They are not even available yet, but I'm very hopeful that several of the programs will be in tribal countries so that we have an opportunity to really test what are the best practices, what does get at the rate of obesity, how do we change chronic underlying disease categories. So we're looking forward to that. Finally, our new Assistant Secretary on Mental Health Services, which is over mental health and drug abuse, is waiting for confirmation in the Senate, but she is well aware of a number of these issues. We've already had those discussions in the interview process, and she looks forward to working directly with Dr. Rubidoux to make sure that our agency assets, both with mental health, addressing suicide, and some of the initiatives that have been mentioned, some of the problems have been mentioned, are again brought to bear on tribal country.
Thank you, Secretary Sebelius. Dr. Rubidoux?
Thank you so much. I'm so grateful for the input that you've given us today on some of the concerns that you have about the health of the people in your communities, and thank you so much for being such great advocates for them. I have made it clear that as we look at the challenges related to health care in American Indian and Alaska Native communities, those challenges are enormous. They seem daunting, but I really think that we have a unique opportunity during this time with this administration, with all of the support that we see, to make significant progress towards improving the health of the people in our tribal communities. And I look forward to working with you on that. I have heard loud and clear from you all in the 6 months that I have been the IHS director, but also in the 16 years of work that I had in the Indian health field, and also as my time as a patient in the system and my time as a healthcare provider in the system, that it's clear that the Indian Health Service is struggling to meet its mission with available resources. And I've heard how many of you have said there's not enough contract health services dollars to meet the need. There's not enough funding. There's waiting times at the clinics. There's, people aren't getting the care that they want. And what I want to reassure you is that the only reason that I took this job as the director of the Indian Health Service is that I want to help us do whatever we can to make as much progress as we can over the next few years towards improving the health of American Indians and Alaska Natives. And the only way we're going to improve the health of our communities as the Indian Health Service, as a healthcare organization, as a business, is to work in partnership with our communities. And so I'm really looking forward to working in partnership with you all. I've heard a lot from you all. I was just counting up. I've had already 27 tribal delegation meetings. I've been to about 12 listening sessions or consultation sessions. I've had 13 meetings with our work groups and advisory committees. I've sent out at least 6 Dear Tribal Leader letters on consultation issues. I've attended 30 conferences. I've been to 4 areas. I have spent the first several months of my being director, the first step is to listen to you all, to listen what your issues are, to listen what your priorities are. Thank you for sending in input to me and in response to those letters. And now I feel like we are ready to move to steps towards taking concrete steps towards working on some of these issues that are of significant concern to you all. I know that diabetes is a huge problem in our communities, but the great thing about that is I think we have a lot to teach the world about what we've already done in terms of the Special Diabetes Program for Indians. We've shown that you can prevent and treat diabetes in our communities in partnership with our communities by incorporating local culture, local traditions, and getting back to prevention and wellness. I always say, as Indian people, we knew how to be healthy. Somewhere along the way, something happened to where we lost that knowledge, but I think we can get it back again. And so I'm really looking forward to working with you on that. I just want to say a couple things. The fiscal year 2010 budget has $117 million increase in contract health services. I'm excited about that. $45 million increase for the Indian Healthcare Improvement Fund, which sort of creates more equity in funding It's still not enough. $113 million for contract support costs and money for dental, chronic disease, health IT, and a number of other things. And so I'm really looking forward to working with you on how we can move forward in those areas where we've been fortunate to get more resources. But clearly, money is not the only answer. And so I've heard loud and clear from you all that you want to have the Indian Health Service to change and improve, to deliver better care, and to work better as a business. And I'm working on that for you and with you as we move forward. The last thing I want to reassure you about is the situation with the H1N1 influenza virus. I know it's a huge issue of concern to you all. We're working closely with the CDC. We're meeting weekly. We're doing everything we can to try to get the vaccine out to your communities. If you are experiencing problems with getting treatment or getting vaccine, please tell your local facility, please tell your area office, and if you don't get any help there, please tell me, because I want to make sure that we're doing everything we can to address the health issues that are affecting your population. And again, I'm really looking forward to working with you. I think we can make great progress, but we have to do it in partnership, so let's see what we can do over the next few years. Thank you very much.
Thank you, Yvette. Thank you very much. Secretary Duncan.
4 points, and this has been, excuse me, just a really thoughtful conversation. 4 quick points I'd like to make. There's a question about year-round schools, and I do think that we need to be doing more to educate our children. I think we have to get dramatically better. I think what we're doing is insufficient for our students to be competitive and to get good jobs, and part of what we need is longer school days, longer school weeks, longer school years. I actually think we need to fundamentally change our idea of what a school is. I think every school needs to be what I call a community school, a community center that's open 12, 13, 14 hours a day, 6, 7 days a week, 11, 12 months out of the year. And those non-school hours, I think, are hugely important. After school, weekends, over the summer, extended learning time, academic enrichment, helping students catch up, but also drama and arts and sports and music and activities for families. And when schools truly become the centers of the neighborhood, centers of the community, social service partnerships there, nonprofit partnerships, healthcare clinics attached to schools, and Secretary Sebelius and I have talked about that. When schools truly become the hearts of the community, servicing not just children, but adults, parents, and grandparents as well, I think great things happen for children. I also think we know the devastating consequences of what we call summer reading loss, and we don't need another study about that. We have lots of children who teachers work extraordinarily hard. They get to a certain point in June, and they come back in September, and they're further behind when they left. That is heartbreaking, that's unacceptable, and we just need to do more to work with our children. So we are looking at ways to continue to expand time and to really make our schools the hearts and the centers of the community. Secondly is Secretary Sebelius has the extraordinarily difficult job of passing health care reform. Once that's done, and that will get done, we want to think about reauthorizing No Child Left Behind. And we have a huge opportunity to build upon what did work. I think what did work is the disaggregating of data and looking at the horrendous achievement gaps between students, and we don't want to lose that focus, and we want to continue to have those courageous conversations, but many things didn't work. What we want to really focus on as we move towards reauthorization is thinking about how you get great adults into our children's lives. Great teachers, great principals make an extraordinary difference. Talent matters tremendously. And how do we systemically get the best and brightest teachers and principals into the communities that have been historically underserved? And many of your communities have been horrendously underserved for decades. And how do we reverse the talent? We talk so much in this country about the achievement gap. The achievement gap is real, it is stubbornly large. I'm frankly more focused on what I call the opportunity gap. And I'm convinced if our children had the chance to be educated, our children from historically disadvantaged, underserved communities had the chance to be educated by the best teachers, by the best principals over the long haul, that achievement gap would disappear. And so that's really going to be the focus as we move forward. How do we recruit, retain, support great teachers and great principals, and how do we get them into the communities that need them the most? Finally, one of the other big challenges historically was a dramatic underfunding of education under No Child Left Behind and going back. And what this administration has done with the President's leadership and the bipartisan support of Congress is extraordinary. There's been $100 billion in new money for education, early childhood, K-12, and higher ed. And while it's never enough, our budget basically doubled. That never happens in the public sector, in the private sector, in the philanthropic community. Your budget never doubles, where ours literally did. And so it's a huge, huge opportunity to invest differently, not in the status quo in ways where we need to improve. What I've heard here today, what we heard in our visits, Greg in North Dakota and South Dakota, is that money getting to your communities? And in many places, the money's slow and it's inadequate. And so we have to do a much better job of monitoring as those resources move out to states, move out to districts, that it's getting where it needs to go. And we have to watch that very, very closely. The final point I'll go back to, and it's been a theme I think we've said and you've said, is that we as adults just have to behave in very, very different ways. That when children struggle, when our dropout rates are too high, when we have drug and alcohol abuse, I really don't blame our children. I think we as adults have not reached them. We're not giving them the support and the love and the guidance and the opportunities they need to be successful. If we meet them halfway, I think our students are more than rise to the challenge. The conversation we had a community meeting like this at Lame Deer High School when I was there, and we had adults and students in a room, and adults were having a pretty good conversation. And a young girl, 14, 15-year-old girl, freshman in high school, just stopped the conversation. She said, "You guys have been having this wonderful dialogue, and I'm just sitting here looking at the ceiling the whole time. We're in the school library." And we all looked up. I hadn't noticed the ceiling. We all looked up, and there was this huge water stain where water had been leaking in. She said, "If you guys really cared, you would have fixed that water stain a long time ago." And so our children are going to listen to what we say, but they're going to watch much more closely what we do. And we have to walk the walk together. I absolutely want you and ask you to hold us accountable for stepping up and delivering, and we got to partner together to do the right thing by children.
Secretary Solis.
Thank you. I just want to reiterate the importance of our programs that we offer at the Department of Labor, especially for the youth and for those dislocated workers. We have, again, high numbers of unemployment across the country, and we know that there has to be an effort made to fund these programs sufficiently. When I came to the Department of Labor in February of this year, I found that structurally the programs that are dealing with our Native American communities and tribes had not been sufficiently funded in the last decade. So one of the efforts that we would like to make and put forward with your help and consultation is to expand that, but to coordinate better with our other agencies so that we are in collaboration, so that I can draw upon some of the other divisions in the Department of Labor to help us. And I have an initiative to make sure that we provide assistance to our Native American veterans to see that they get assistance for training, job opportunities, and the right to return to a job, those especially veterans that are coming home that are serving right now in Iraq and Afghanistan. They need help. They also need to have assistance once they hit the ground and come home, so that if they have any disabilities, that we provide them with that identified support in a setting that you can look at in terms of a community center that welcomes them, that gives them information for job training, helps them apply for a job, but walks them through the process and sends them to referral agencies that come from the community. That's where the best work that I have seen comes from, when it's done in communities where people can trust each other. I was very pleased to be able this year to go to Pueblo, New Mexico, and go visit some of the tribal leaders and governors. But I was more struck by visiting one of our Job Corps centers, where there were students living in this residential program. Most of these students would be qualified as losers by society, and most of them have been failed by our education system. But when I met with them, they came with the essence that they wanted to change their lives, that they too knew that they had to escape some of the things that constrained their ability to be who they wanted to be. And I was very proud to see many of them entering into engineering, science, and health fields, and even welders. I mean, let me tell you something. I can't explain how important it is for us to provide all educational, whether it's vocational and higher tech training, to all our Native American tribes and our students. And the importance is backing it up with that kind of care, assistance, and monitoring that goes through that cycle. Because it isn't just you put them in school and then they go out and they're gonna be able to survive. We need to continually provide that continued support and make sure that we are working collaboratively with all of our agencies, whether it's HHS, whether it's Department of HUD or whether it's education, and just bringing that all together. I think that's very, very important. I have hired someone in our public engagement office who is Native American, Miss Willis. Some of you may know her. Yesterday, she led our discussion at the Department of Labor with our agencies and with our deputy assistant secretaries. We, again, want to just reiterate how we want to work with all of you to have these consultations and advisors throughout the country. Please contact us. I want to also just, in closing, say that I know the issue of sovereignty on the tribes is very important with respect to labor laws. Number one, I have to tell you, coming to the department, we had a very, very bad record in terms of protecting workers. People die in the construction industry, in the mining industry, in the poultry industry, in different service areas where we have a higher representation of Native Americans and minorities. We have to change that. And we have to be able to enforce our laws to make sure people know their rights, working with business too and with the tribal nations so that we all are on the same page. This president wants to see all of us be successful, and we can do it by working together. With respect to some of the labor laws, I know some of you are concerned about discussions regarding the Employee Free Choice Act. It may have come up, or NLRB, National Labor Relations Board. I know you're going to work with Congress. I know those discussions are going on, and I applaud you. And we have to work in that direction. There will be a solution, I hope, and that we can all agree on. But we do respect your sovereignty. Thank you very much.
Thank you, Secretary Solis. And Congressman Dale Kildee.
I'll be very brief. I'm in real life a teacher, and I am going to work very hard, particularly on funding for Indian education from birth through graduate school. What we did do in HHS was we increased Head Start, rewrote Head Start. The last official act that Ted Kennedy and I did together was to rewrite Head Start. That's an extremely important program. And we put in a really significant set-aside for Indians. And that is going to be very important. Head Start's a great program. You deserve more. And one other program, Johnson O'Malley. I know we're on tight schedules, so I'll yield back to the Secretary.
Thank you very much, Congressman Kildee. Let me just say that we are getting close here to wrapping up and hearing from the President of the United States and the White House leadership as we move forward. But I do want to say this. It is, for me, an honor to be a part of President Barack Obama's administration. You have heard from a stellar group of people, the Cabinet, and they have heard from you today. And thank you so much for participating in this. They are the best. Thank you very much. Now, we have a lot of work to do together, from the lack of jobs and the poverty across Indian country to a greater day of prosperity, from the major issues of health care, which are so poignant in Indian country, to the educational issues that Arnie so described. There is so much work that we have to do together, and we will do that together. If you will just stay where you are, we will be continuing the program in just a few minutes here. I appreciate you all being a part of this, and thank you for a stellar White House conference on tribal nations as we establish a nation-to-nation relationship. Thank you very much.